Hello, New Jersey HOSA. Welcome to our bleeding control workshop, where we'll be getting into some of the skills and concepts necessary for you to understand how to treat life-threatening bleeding in the field. Now, let's start off with some introductions first. My name is Dorian Ho, and I'm serving as your state parliamentarian for the 2020-2021 year.
Hi everyone, my name is Meghna Subbaiah and I'm serving as your state secretary for the year 2020 to 2021.
Hello everyone, my name is Pratham Bhatt and I am serving as your member at large for the New Jersey HOSA State Executive Council.
So right here, we're just going to give a quick layout of what a workshop's going to look like. First, we're just going to go over the types of bleeds so we can recognize and differentiate between arterial, venous, and capillary bleeds and their levels of severity and priority. Secondly, we're going to go over controlling blood loss with direct pressure and tourniquets, the concepts behind some of those in-field skills. And thirdly, we're actually going to go into a demonstration of basic bandaging techniques, courtesy of Meghna practicing on her brother. So I guess the first thing to really familiarize ourselves with in talking about bleeding is blood itself. So blood is this fluid matrix that we're really going to see making up about 9% of all of the fluid in our body. But it's really important in that it's responsible for circulating oxygen and nutrients to cells and tissues while also removing waste products such as carbon dioxide, say. An average adult has 4 to 6 liters of blood, depends on things like age, gender, height, and weight. Males typically have more blood than females, and babies have approximately 1 pint. In pints of blood, I believe we have somewhere between 9 and 12 for adults. And when we're talking about bleeding, what we're really talking about in the medical field is hemorrhage, is the word we use. Hemorrhage, which is blood loss, can deprive cells and tissues of oxygen and is extremely life-threatening because it's also related to fluid loss, which might lower blood pressure and lead to hypoperfusion or shock, and all of these nasty things that you wouldn't want your body going under. So first things first, let's just go over the types of bleeds. I mentioned arterial, venous, and capillary before, which are all pertaining to the 3 types of blood vessels we mainly see in our bodies. Now, just for a little bit of interactivity here, just think about which of these bleeds might be the most severe and why that might be. Now, without further ado, let's get into the first one with arterial bleeds. Arterial bleeds are injuries to arteries, as the name might imply, but arteries are, remember, the vessels that would carry blood away from the heart and to cells and tissues. They're high pressure vessels, so it makes sense that their symptoms would be spurting bright red blood. Bright red color caused by oxygenation of the red blood cells within them. Now, these are really high priority bleeds because they're extremely life-threatening. Whether it's the femoral artery or the brachial artery, a lot of these arteries, once severed, can lead to bleeding out that is just very critical and puts the patient under a lot of stress in that regard. For treatment for this, we would typically use direct pressure, but in these situations, we may need to see tourniquet use, maybe even double up on tourniquets. If it's uncontrollable, that definitely would be an option. Moving on to venous bleeds. Venous bleeds, you might think, well, veins are low pressure systems, so shouldn't they be lower in priority? Well, this is also true, but even though they're medium priority, they are potentially life-threatening. Venous bleeds in large veins, think about femoral vein, etc., great saphenous vein. These are rather large veins. And the thing is that veins actually carry most of the blood in the body at any given point. So the symptoms we're seeing here are oozing dark red blood, dark red because of deoxygenation. That's going to be oozing out of the bleed at a fairly steady rate. How would you treat this? Well, the same goes for all bleeds. You might notice a pattern is using direct pressure unless a large vein is impacted, in which case a tourniquet might be necessary. So these are also potentially life-threatening, but they are more manageable than arterial bleeds. And finally, we have capillary bleeds. Capillary bleeds are your more run-of-the-mill paper cuts. You're very low priority, definitely non-life-threatening. Capillaries located very superficially to the skin surface. are where the oxygen and all that filtration and diffusion occurs. So you're going to see a slow trickle, dark red blood typically, and these can almost always be stopped with direct pressure and will resolve themselves on their own because our body doesn't need direct pressure necessarily. It can use mechanisms like clotting to deal with minor infractions like this. So now going over all of those types of bleeds, we've mentioned some of the treatments that might be used for all of them. You may have noticed a pattern with all of them, which is of course that direct pressure can be used for all of them. Tourniquets might even be used as another resort. So Pratham, why don't we get into how to control bleeds?
Controlling bleeding is an important aspect of treating these life-threatening situations. And the first thing you have to do is apply direct pressure. This slows down the blood flow at the site of the injury and might even stop it completely. This allows clotting to be facilitated and can help recover. So the bleeding control procedures. If the bleeding is severe, then the first step would be to call 911. And when in doubt, always call 911. Next, you should follow standard precautions. Clear the surrounding areas around you to make sure that the patient is safe of any hazards, and then wear personal protective equipment if available. This includes gloves or eyewear, especially if the blood is at risk of splattering. Then you apply pressure. If you have dry, sterile dressing, make sure to use that, and layer if the blood is soaking. Make sure not to remove these dressings as this can potentially remove the half-formed clots, and this will cause the clotting process to restart. However, if direct pressure or dressing is not immediately effective, apply tourniquets to extremities about 2 inches above the level of bleeding. Now, if you do not have access to dry sterile dressing, especially if these are urgent situations, then you can make use of other items such as clothing. And this is temporary until 911 or support comes. Now we will have Meghna describe how to control bleedings using direct pressure.
So I have my little brother here, and he's going to give you a little demo. His little arm is here. So start off by, we're going to pretend that he is bleeding profusely. So you're going to start off by taking a 4x4 gauze, very simple, and taking 1 to 2 to apply directly to the blood bleeding area. So you hold pressure here. And you can even ask the patient to hold pressure while you get your additional supplies. So can you hold the area like this? Exactly, just like this. Can you see it? Yes. Okay. So once you're ready, you can take the area and take a roller gauze and put it above the wound dressing, and then hold it as you're taking another roller gauze and holding it on top and wrapping it effectively. Try to get as tight as you can so that you're getting as much pressure as you would be if you were directly holding it. So just continue unrolling. And obviously, since this is an emergency situation, the neatness of this bandage is not the importance. It's all about stopping the bleeding and controlling how much ever you can, because blood loss is a lot more important than how pretty this bandage is. And it's not going to be pretty, I promise you. So while I'm wrapping, we can talk about other types of bandages. So this, in turn, is called a direct pressure bandage. While others, you might not need this much pressure. So for example, a venous bleed, you might not need this much pressure. And for a capillary bleed, a simple Band-Aid will do. This is primarily for an arterial bleed. So now we are at the bottom of this roll, right? And see, I understand that I did use an entire roll, but it is useful because you want to make sure that that pressure is there to stay and it's not going to come off. So like I said, you have this end of the roll. So what I want you to do is hold your hand out. Thank you. Hold the table. And then you take it and loop it around. So take my finger, loop it, and then tie a simple knot. Right, like so. If it'll let me. Just like that. And you can even tie a double knot if you would like. So we'll just tie a double knot just for fun. And that is it. So we have direct pressure. How do you feel?
Good.
Good. All right. Back to you, Dorian.
Yeah, of course. That was really informative. I think we were back to Pratham, actually, talking about tourniquets. I think that would.
So now let's go on to tourniquets. Tourniquets should most definitely not be the first choice, especially since you have direct pressure. They should only be used for severe bleeding, amputations, or mass casualty incidents. This is because you have many patients to treat, and you want to make sure that you are effectively treating them in the fastest time possible. And by applying tourniquets, it saves you the time of the lengthy direct pressure procedure, as depicted by Meghna. This should only be applied to extremities, which are your arms and legs, and it should be applied high and tight, so over the area of where the bleed is, not underneath or not directly at the area. Commercial tourniquets are preferred, especially if you are an emergency responder. However, they can be improvised similar to direct pressure. For example, if you have a t-shirt, you can tightly tie it around the patient's arm or leg or wherever the bleed has occurred to make improvisations. Now, when you're putting on a tourniquet, you should tie the knot 2 inches above the wound area. Of course, you don't have to be specific or precise. However, this is just a general recommendation. Next, you should insert the windlass and tie another knot around it. This is to tighten the tourniquet. You have to make sure that it does not unwind, because then the pressure will be released, and this is the main purpose of the tourniquet itself. Now we will have Meghna explain a little bit more about tourniquets and how to use them.
So basically, tourniquets are a very last minute and only pretty much used for controlling arterial bleeds. The issue with tourniquets is that when used for a prolonged period of time, they can result in necrosis in your extremities, and that's basically when the tissue dies. Obviously, it's not getting blood flow. And that means there's no nutrients or oxygen going to that extremity. So basically, what you're trying to do is you're trying to cut off blood circulation when you can, and also when you have no other choice, when you have no resources to support you, because obviously life over limb, right? So just a standard mention to put on tourniquet is you want to record the time that you when you applied the tourniquet, and so that you can let the emergency personnel know how long this tourniquet has been applied. Back to you.
Well, thank you. Thank you both, Meghna and Pratham, for the demonstration and the explanation. I really appreciate that. Here we just wanted to leave you with some key takeaways. Well, what can we really summarize from this lesson? What can we learn about bleeding control and what we might be taken to the future? Well, the first thing we discussed was just the types of bleeds. So types of bleeding, we would look at the 3 types of blood vessels we have in our bodies: arteries, veins, and capillaries. Arteries being the highest pressure and being most likely to release the most blood in the shortest amount of time would be the most severe. And so you can see that requiring the most care and the most priority. Well, how might you treat all these types of bleeding? Well, we talked about direct pressure. Direct pressure being the mechanism by which we insert pressure through bandages or even just gloved hands, keeping pressure on the area to facilitate clotting and make sure no extra fluid is leaving the body. Well, what if direct pressure doesn't work? Well, direct pressure might not always work, and in that case, we might need a tourniquet. A tourniquet simply being any material that can be wrapped around an extremity and prevent the flow of blood to that area to prevent blood loss from a severe bleed. Tourniquets can be commercial or improvised, but they're normally used as a last resort, and almost always a commercial will always be preferred to an improvised tourniquet. Well, with that out of the way, we thank you for coming to this workshop. We hope you did learn something new, and feel free to follow us at NJHOSA on Instagram, and really enjoy your time at the regional conferences.